Oh, okay. Well, thank you very much, Doctor. Now, recently, if we read in the news, is something that has been on the lips of many Nigerians, especially African countries that are much affected by this here. Recently, the United States government halted the support for HIV treatment in Nigeria and other developing countries following an order by President Donald Trump during the inauguration. In the States, the U.S. Department stopped the disbursement of funds from the President's emergency plan for AIDS relief, a program for HIV treatment in Africa, developing countries for at least 90 days, which also includes Nigeria, Malawi, and South Africa. And then the action originates from President Trump's executive order on foreign aid, which he signed on his first day in office. So the order instructed all government agencies managing foreign development assistance programs to halt disbursements of HIV treatment, which also includes some of the countries we've mentioned, which Nigeria is also a victim. Now, with the annual budget of 6.5 billion US dollars, I'd like to reiterate that 6.5 billion US dollars. So this is actually a very, very bigger one there. For PFAD delivers HIV/AIDS treatment to more than 20.6 million people. It has helped save lives and curb the spread of the virus. Now, when I was going through the UNICEF, kind of statistics we had from UNICEF, it says that there are some certain areas where Nigerians, or Nigeria, so to say, also have benefited here. Now, looking at the brief stop of what this is, publication about HIV and AIDS in Nigeria were published in 1986. So in 1986, the first case or the first discovery of HIV was noticed there. Now, scientists believe that HIV originates from chimpanzees in West Africa in 1930s, around that time. And so the virus spread to humans through blood-to-blood contact, through sexual intercourse, which I'm sure maybe as we talk on this one, you can elaborate more. But we're looking at the indices and the level of contraction. Now, according to UNICEF, Nigeria has generated HIV epidemic with a higher number of HIV infections and deaths. Okay, Nigeria was the second in 2015. Around the world, if you want to mention every country, Nigeria was the second, which also calls to mind that it is indeed a very, very serious situation. So UNICEF studied based on HIV infections in Nigeria that in 2015, Nigeria has 190,950 HIV infections and deaths and all that, as we continue to talk about it. Now, to come down to our discussion today, as we move forward, Marvelous,
Yes.
we're actually trying to see how we can have this discussion together.
Yes, well, I mean, I would really, I would like to ask the guest if maybe he knows the reason behind this. You know, Trump is just in office for a few days, if I can say that, and he has already done so many things. What do you think would be the reason behind Trump's decision to withdraw aid to Nigeria and some other African countries? What do you think would be the reason behind this?
Okay, first of all, when we take a look at Trump and where Trump is coming from,
Yes.
Trump is a businessman, he sees government from the business perspective. He believes that wastages will not be there. He believes that efficiency is such that least cost is utilized in bringing out the maximum production. And then Trump is one person that believes that there's no free lunch. He believes that everybody has to work. So he believes again that past presidents of our US have been, placing money, spending money on justified spending. And he feels that HIV is one area that the federal government of US are actually been spending money. Just like you mentioned, over $6 billion per annum, being spent on HIV treatment alone. And the money keeps on increasing, and without much achievement of results, halting the HIV infection. So I think Trump wants to, as much as he could, he wants to come from the bigger angle where you see things that he must bring in efficiency, he wants to contain expenditure, and more importantly, which is the remote reason, Trump wants everybody to come to the table to recognize America is the big, the big boss here. So if he's going to do anything for you, you would actually have to, earn it, either by pleading with him or doing anything. For me, I think that Trump is a bully, if I must say it, and the way he goes about it is just like a poor capitalist who is a bully. That's the way I look at it.
All right, thank you.
Oh, all right. Thank you, Doctor. Now, very quickly, let's have this question. Can you explain the significance of PIFA program and its impact on HIV treatments in Nigeria? Given the America's contributions to HIV treatments in Nigeria, what can you say are the benefits that all Nigerians benefited from this program?
Okay, today, Nigeria has over 2 million cases of HIV treatment going on. And these patients have been on medications free of charge. They are testing everything. In fact, if you go to HIV clinic, like I have in Parkland anywhere, or in any other bigger hospital, you discover that these patients are treated without incurring any cost. The cost they incur is cost of leaving their jobs and coming to the hospital. Now, it has actually helped in reducing the HIV infection to a great extent. It has actually improved on the outcome of management of HIV. However, the burden has increased with over 2 million Nigerians on daily medications, of high active HIV medications. And many have achieved viral suppression. When I mean viral suppression here, where you find it difficult, the person will no longer transmit infection, or the viruses may not be able to be detected if you subject them to treatment, to test. So the Nigeria has actually benefited immensely, I must tell you that. Although on the flip side, one which we have not tested is hypothesis, one has not tested that. We may not have understood clearly, assuming if we have been managing HIV without any help, what could have been the outcome? The one could actually look at malaria, which we've been managing other diseases without so much help. We have not really done much on that. So we could say that Nigerians have benefited much, but we might be better, if the HIV funding is cut. Remember, most of these fundings do not really cost. I must tell you. What time you hear 2 billion expended, but remember, the drugs, the analysis, many of the staff that work here are even, the money goes back to American companies. So you might not really see the bulk of that money coming to Africa. So let's look at it critically from two angles. Assuming if we have to pay for the drugs, can we source out these drugs from elsewhere, India and some other places at the cheaper cost? Because you might be hearing that 6.2 billion was spent on HIV medication per annum. You might really see that less than half of that money actually is expended on treatment here in India. So I think we look at it critically. We see over the next 90 days. It says it's going to review, place it on hold for 90 days and review it. One thing that's clear is that
yes,
if you fail to manage HIV properly, does not place barrier on transport, you might see that the reinfection, or you might see the resurgence of reinfection across the world. Remember the time COVID came to the world,
yes,
every part of the world was touched. So we believe that let's watch for the 90 days and do an analysis. I think that's what he wants to do and see how it has affected everybody. But I can tell you, it's not only Nigeria that would affect. It would affect employment, would affect the drug and pharmaceutical companies right there back in US. And by the way, if the drug becomes more expensive, you might see that other alternative sources, like from India, China, or even the country itself, pharmaceutical company in Nigeria and Africa, might begin to produce, some of these drugs.
Now, I think that you are a medical doctor in Enugu State, and I have that wrong, and I said Delta State. Please, apologies. Okay, now, to move forward.
I was about correcting that.
Yes. Do you think that Nigeria, outside the help of the United States, that Nigeria can stand strong and be capable of funding HIV treatment in Nigeria?
Our health system is in by because it doesn't really take care to not have fund. In every other infectious disease, we've noted that the poor finds it difficult to, to access health. We are so much dependent on out-of-pocket expenditure. People paying, when they get to the hospital across the federation. Insurance is quite, poor, so that penetration. So access is difficult. And you have a lot of Nigerians that are poor. So over 100 million Nigerians are below poverty line. So when you pick all these indices and together, you discover that it is going to be a difficult one for us. Without a national approach, without a presidential, approach to it, it might be very difficult. You need people that should think out of the box, to come together to see if we can pop HIV treatment, if you cut the funding source. Because Nigerians might be left on their own. I can't really remember any of these illnesses that Nigeria had actually taken good care of. So I'm afraid if we leave it, if America withdraws our support, we might have a very difficult situation in our hands. The patients may not be able to access the medications as they are doing it today. The patients may not be able to comply with the medications because these drugs that are today is taken for life. So it might be very difficult. I say this at the background of the fact that there are so many other illnesses that have been that are chronic, like hypertension, diabetes, and we find that many cannot afford the treatment. Now, if you go by inflation rates today in Nigeria, it's difficult for you to say that Nigerians will be able to afford the treatment at the present cost. I think it's a little bit difficult for Nigeria, especially the way we run our health. But the other side of flip of the side is that you can never say for sure what Nigerians will do if HIV support is cut off. I said this because I remember during HIV, during COVID era, Africans ramped up, come together and then be able to demonstrate that they have some resilience in them. But I am not too optimistic, of what the resilience of the health system will look like if this support is withdrawn. But let's watch as we've done it. Let's watch over the next 90 days and see how it looks like.
Oh, okay. Now, you talked about whether Nigerians may not be able to have access to these medications. Were you referring to maybe some persons hijacking the process, or that Nigeria will not at all be capable of providing these drugs to Nigerians?
No, it's not anybody hijacking it. As a practitioner, I work in HIV clinic to a reasonable extent. And I understand that the services rendered there, from the counseling to the testing to periodic monitoring, if you extend that and see other patients in the facilities, they can't afford the treatment. Reason is not far-fetched. You see, many countries don't operate out-of-pocket expenditure. Unfortunately, the middle low-income countries, like Great Sub-Saharan Africa belongs largely, and Nigerian, have been utilizing out-of-pocket expenditure. Let me explain what out-of-pocket expenditure is. When people expend up to 40% of their income, on healthcare services or healthcare, medications, healthcare services, it impinges so deeply, on the monies you should have used on other things like school fees, rent, and so on. Now, or when you have spent so much money that you are unable to feed yourself very well, because you want to purchase out, it becomes catastrophic. It pushes people into serious burden, and that has been largely what we are practicing here. Health insurance would have been an easier way out, which have made people to go into the hospital. You pay in small aliquot over time. You pay a premium, maybe 1,000, 2,000 naira per month over the years. And if 200 million of us, let me say about 150 million of Nigerians, are able to pay that, 1,000 naira every month or 1,500 naira every month, you see that will be so much money in the pool that you can walk into the hospital. You might not be suffering from HIV. I am suffering from it. I can walk into the hospital and your own fund, will augment the fund that should have been, procured the medication. However, what we found is that Nigerians are not really believing, saddled with corruption and so many things. Inefficient system we've been running, we are having some difficulties. And then sometimes the managers in the system do not really understand exactly what to do. I have to indict from the managers here, as well as some of them are my colleagues. But the issue is that the bottom line is that many do not, have health insurance coverage. And then that now makes it that if you walk into the hospital today, right from paying the card, the protecting the card services, buying card, paying for consultation, paying for laboratory services, paying for medication, pharmaceutical services, any services, you will have to spend the money. Now, health is such a business that nobody plans to be ill. The illness is such a sudden occurrence, and people are not prepared for that. So, we have actually given us the opportunity and we would have lived on that opportunity, to pay small, in to access help. That is what is done in so many developed nations. People don't go into the hospital to pay full bill. They pay. Let's say, for example, you had a surgery or you had a treatment that cost 100,000 naira. You might be expected to pay just 10% of it, and then you go home. That would have been easier for those of us who are practicing health insurance, like the civil servants at federal and state level. They may not have some difficulty. They may tell you their experiences with health insurance is relatively, better off than being catastrophic. So I am seeing that people may not have that fund. I take my time to explain this health insurance to everybody so that we can understand the meaning of access. People may not have that fund to access that health care. Not because somebody somewhere wants to, stay for the fund. No. Fund is never enough, and we needed to get efficient management of that fund. It's not forthcoming within our health system.
Thank you very much, Doctor, the Secretary of Public Affairs Analyst in Enugu State, and also a doctor in Enugu State. Thank you very much for joining us, Dr. Obasi, for joining us on the discussion this morning. We appreciate it. Thank you very much.